Hi, everybody. Thanks for coming in. We're just waiting one more minute and then we will start, but very grateful to see you all entering. Yeah, great if you can already put into the chat where you're from and which organization you're with so we can start to get to know you. We see someone from War Child here. Greetings. Greetings all the way to Morocco as well. Somebody from Amsterdam, one of our very good friends at Rituals. Welcome. More Anna in the Hungarian office of UNHCR. Welcome. Great, cool. I think we can make a start. Welcome to this webinar. This webinar is supported by the WellU project, which is co-funded by the European Union. We'll be going more into the background of this project in a moment. I'd like to, say that we're here to learn about the ReachNow tool and its application, both within European context to support Ukrainians who've been displaced, as well as getting a case study from its application in Ukraine itself. Here speaking today will be Meerte van den Broek from War Child Holland, who is the lead researcher of the ReachNow tool. We will also have Julia Jujuk, who's coming in from Voices of Children, based in Ukraine, and Julia is the program manager. And Pamela Nunez will also be speaking from SOS International Office, and she's coming in as the mental health advocacy advisor. And then there's myself. My name is Anna Devereaux. I'm the Research and Development Scaling Coordinator here at War Child Holland. And I'm so grateful to see everybody who's joined. So keep on putting into the chat where you're coming from. And very happy that you're here. This project that we're speaking about today is under the WellU umbrella, which is funded by the EU for Health programme, implemented by HDEA, who are the European Health and Digital Executive Agency. The purpose of this project is to promote mental health and psychosocial well-being of refugee children and their caregivers through lay professionals amidst the Ukraine's displacement crisis. And around the table in this consortium are SOS Children's Villages Italy and International, Terra da Home Hellas, which is in Greece, Romania and Hungary, and War Child Holland. So we're implementing in 4 country contexts, which are Romania, Greece, Italy, and Hungary. The objectives of this project are to increase the capacity of non-MHPSS professionals to support Ukrainian children and their families affected by the war, to improve the mental health and psychosocial well-being of these population, to raise awareness of best practices and evidence-based methodologies to support mental health and psychosocial support outcomes, and to advocate for a public health approach to mental health. The methodologies that are included in this project are Team Up, which is a basic mental health intervention that promotes psychosocial well-being through movement-based activities. MGSC, which improves resilience and psychosocial well-being of vulnerable children through sports, games, and creativity. So they're both here at this basic psychosocial support level. ReachNow is a tool that can be integrated in those methodologies, which identifies children who may have additional mental health needs or who are experiencing psychosocial distress. And it also supports the encouragement of help seeking and linkages to level 3 services. One of those services is part of this tool, part of this program, which is PM Plus, Program Management Plus, which is available for adolescents age 16 plus and adults. And all of these methodologies are integrated into the various implementing organizations' programs where feasible, relevant, and needed, and complemented by other methodologies that are already going on in existing programming. Now, who are War Child? So Mirta and I are both from War Child Holland, and our goal is ultimately to improve the psychosocial well-being of children affected by armed conflict, and to increase resilience of children. And we hope that we can reach millions more children affected by war and conflict through evidence-based methodologies. We have a research and development department, of which Mirta and I are both sitting in, and a research agenda which is developing a number of evidence-based methodologies in the topics of psychosocial support and mental health, child protection, and education. We won't be able to go through the plethora of methodologies today, but here's an example of our care system approach, which is socio-ecological, multidisciplinary, and multi-leveled, which hopes to focus on, combining a set of methodologies in order to have a strengthened, combined approach. And ReachNow is one of the tools included in this care system. Then I'm going to hand over to my colleague Mirta, who will start to talk about the ReachNow tool.
Thanks, Anna. So let's start with a bit of background. So worldwide, about 10 to 20% of the children experience a mental health condition. And what we also know is that about 75% of those conditions that are diagnosed in adulthood have their onset already at the age of 24. Yet only a very small percentage is identified when they were young. So, and even of those that are identified, an even smaller percentage seeks help. And this leaves us with a large mental health care gap, which is basically the gap between children in need of services and the services that are there. This gap is both caused by supply side barriers and demand side barriers. So from a supply side, you could think of a lack of mental health services that are available, or a limited number of mental health workers that are there. From the demand side, you could think of stigma around mental health, or not knowing where to seek help, or not knowing what the symptoms are. So the project that we're presenting here is really focusing on improving community level proactive detection and promoting help seeking among children and adolescents, and really targeting those demand side barriers.
The tool takes a gatekeeper approach, which looks at community members who are able to be a gatekeeper into children's access to mental health care. It uses contextualized illustrated case vignettes, which have a very simple story describing a child, and a very simple decision diagram, which helps the user to make a decision on whether or not to encourage help seeking. There are two validated versions of the tool. One looking at behavioral problems, and the other looking at emotional problems. And there is a story and illustrations which match behavioral and emotional displays of distress. And the tool also contains the most common symptoms of severe mental health problems, and it uses really localized idioms of distress.
And the idea of presenting those symptoms in a short case story is that it becomes kind of a prototype. So after being trained for 2 days, community members will be able to match their ongoing daily observations with the tool. So there's no need to actually use a screener or a checklist of symptoms, because these stories will really serve as a mental image, and it can be used as reference material. It's important to note that a demand-generating strategy like ReachNow is only safe and ethical or relevant in places where there are services available that could follow up with a needs assessment, for example, and also provide care. And it's also important to note that it's not a diagnostic tool. So after being proactively identified and when help seeking is promoted, the actual assessment of the needs will happen at a service provider.
Then just to go quickly into some research conducted on the ReachNow tool, there have been 2 accuracy evaluations, one in the occupied Palestinian territories, whereby 3 out of the 4 children who were identified were correctly detected by children after an evaluation with a mental health service provider. And in Sri Lanka, 2 out of the 3 children were correctly identified by community members. So this means that from the children who were detected, around 70 to 75% of those children were correctly identified and then could be referred to mental health services.
Yeah, thanks. And then what we did as a follow-up from the accuracy study, we measured the effectiveness. So looking at how many of those children that are identified by people trained in ReachNow actually made it to care. And we conducted this study in Uganda in 5 refugee settlements, and we compared the ReachNow effectiveness with ongoing routine identification activities. And the results showed that there was an average significant increase of 17-fold of help seeking. So this again underlines the importance of then also making sure that those services are available. Then the most recent study was a proof of concept study of a new element. This was not part of the WellU project, but we've seen that ReachNow is really being scaled. But then we also wanted to maintain the quality, of course, when it's being used on a larger scale. So we developed a dashboard for organizations that are implementing ReachNow. And supervisors could then easily access the dashboard to see 3 main indicators. So first of all, how many children are identified? Second, how many of those identified actually made it to care? And third, how many of those that made it to care were in need of mental health care? So that during the supervision sessions, the supervisor could do some additional capacity strengthening, for example, or we could make sure that some additional reminders were sent to families. And the results of this proof of concept study showed that both the mental health service utilization as well as the accuracy were increased by 2-fold.
Great. Then we will just talk quickly also about ReachNow implementation and show you an example of some of the main questions that can be asked in order to decide the implementation plan for ReachNow. So first, you need to know who are the end users, who will be using this tool, and who is in daily contact with children who will be able to, identify these signs in children and encourage help seeking. You also need to ask yourself who will train them and who will supervise. The second point is around the first point of referral. So this is asking who and where will help seeking be encouraged to? So who will the end users be encouraging families to seek help towards? And this would need to be done by someone who can do a mental health evaluation. And another question for yourself is, how will the mental health needs then be evaluated? The third point is around the referral pathway. So whether there are services that are available for moderate and severe cases, asking yourself whether these services are accessible, affordable, and acceptable, making sure that there's a system in place for monitoring of the caseload, and an immediate response protocol for high-risk cases. These are some really critical questions for integrating the ReachNow tool into an ongoing program. And that's something that I really want to emphasize is this is a tool, so it can be integrated into other ongoing existing responses. And it should really, slot into existing systems. Here's some information about the criteria for end users. And these are the top 2 priorities. So firstly, there should be day-to-day contact with children and adolescents. This doesn't need to necessarily be daily, but rather that it's regular contact whereby you can see behavioral changes in children and adolescents. And the end users also need to be trusted, because without trust, that help-seeking encouragement isn't going to be successful. So it's really important that these people are in a good position to be able to do that encouragement of help-seeking towards the families. some information on the profile of the trainer and the supervisor. So generally, training end users, there would be 2 trainers, around 2 trainers to a group of 15 end users. And we recommend that 1 trainer should have a professional MHPSS background. And this person with the MHPSS background can also then go on to supervise the cases later. We don't have a very strict threshold for how many supervision sessions should be done, but we recommend at least 2 sessions, either on a group level or individual, after the training in the first period of implementation. But depending on your implementation plan, you may decide to adjust this. Then some information on the first point of referral. Again, this should be accessible, affordable, and acceptable. It should be a lean process. So that means that there are no unnecessary assessments done or visiting multiple service providers. And the best way to ensure this is that, for instance, if there is a MHPSS service provider able to conduct the needs assessment, then they're already able to offer services where it's appropriate. And that makes the pathway quite lean. This might not be available in all circumstances, but this really is a best practice that we would recommend. Now we're going to talk a little bit about the cultural and contextual adaptation process.
Yeah, so all of the methodologies that Warchild develops and offers for scale come with a cultural and contextual adaptation process guidance. So in the next slide, we will show you a bit more about the process that we follow for ReachNow. So whenever ReachNow is used in another context, there's 5 very simple steps that will need to be followed. So first of all, there's an adaptation workshop where you could invite both mental health professionals from the country, but also people that are working directly with children, to really capture, through free listening, capture the most common signs of childhood psychological distress, and to also probe for what are the most common idioms of distress that people are using, what are the day-to-day words that we use, and how are they expressed. Based on that list, we would do a prioritization exercise within the workshop, and we make sure that we have the vignettes or the case stories adapted to the local context. Then once that's all done, we move into the translation. And in the translation, we first translate from English into the new language. Then we search for an independent, another translator who's blind to the original text to translate it back into English, so that we could also spot the errors there and make sure it really captures the relevant meaning. At the same time, we're also working with an illustrator who could work on the 6 illustrations for each tool. We have several feedback rounds with, again, a group of people that are working with children and service providers. And then once we have a very zero draft protocol, we move into the validation, and that's done through focus group discussions, and mainly with people that could potentially be end users of the tool, again, to make sure that the vignettes are understandable, that we don't use any stigmatizing language, but also to make sure that the illustrations are understood in the right way. And this process, we go back and forth until we have a tool that is really applicable to the context. And in the next slides, we have a couple of examples. So for this project, the WellU project, we did the majority of the process we did online. So first we did the adaptation workshop through multiple calls with about 20 participants from Ukraine, but also from Moldova, Poland, all working with children. And here you see how we collected all the most common symptoms. At the same time, we really probed for how do these symptoms are expressed. So in the chat, you could also see what kind of examples people came up with. Based on this, we developed new case stories, and then we moved into the illustration development. And here you see how the different illustrations look like for the different tools. So one of the very first versions was for the occupied Palestinian territories, and then we had one for Greece and Italy, and we now have one for Ukraine as well. As you can see, it's about 70% of the symptoms or the illustrations will be almost similar. But from the Ukrainian workshops, what really stood out was, for example, some signs of separation anxiety. So children that were really showing excessive worries about parents that would leave the room, for example. They were scared that they would never come back, or during playing outside, and when they heard an unexpected noise, that they would really startle and freeze, for example. So that was one of the things that we really had to adapt and integrate into this tool. Then we moved into the sketching phase. So first of all, this was one of the first sketches that the illustrator came up with. We did again a round of feedback with service providers and with an internal group that worked on the different versions of ReachNow. And here, this illustration should show signs of separation anxiety, but instead the majority interpreted this as a child that was a bit scared. Maybe the parent did something wrong, or so we had to make some adjustments. And here you can see the end result. Then the next one, we can do a short quiz in the chat. So we have two versions. So on the left side, it was one of the first versions. And after the validation workshop, we ended up with the illustration on the right. And I'm curious to see, can you spot the difference? And maybe you can put it in the chat. Let's see if someone can see the difference. Okay, yeah, great. Yeah, a smile of the middle girl, facial expressions. Yeah, exactly. So we first had the first one that children that the children were enjoying themselves. But then one of the major points of feedback was indeed like they shouldn't be looking like they were enjoying themselves. So indeed, the facial expression was changed. Then another one. Let's do it again. This is more obvious, but can you spot the difference?
And maybe it's nice to hear from you, like, why do you think we made this change?
So, anyone in the chat? Yeah. The cloud of words, exactly. And any idea why? Why we had to change it? Okay, let me just tell you why. So through the validation workshops, so through the focus group discussions, it was very clear that those exclamation marks were not really well understood. People were a bit confused, like, what does it mean? And for us, it was really clear that this is a child that is actually not following the rules and interrupting the teacher, for example. But since that wasn't really understood and people were really confused by it, we moved into a next version, which had just empty word clouds. So these are just some very simple examples of how the adaptation process really helped us to create a version that was culturally sensitive. And now we move into a case story.
Yes, and before we move into the case study from Julia, actually, I would like to introduce a poll, which I should have introduced at the beginning, so I'm very sorry to my colleagues. But this poll is part of our routine monitoring and evaluation of the project, and it would be great if you could please kindly answer a few questions. And we'll just give a moment, and then I'll hand over to Julia, who will be sharing an example from Voices of Children and their implementation of the ReachNow tool. And just to note, Voices are not part of the WellU project, but it's really great to see how they've been able to adopt the tool and make use of the tool as an output from this contextualization and validation, which occurred under this EU for Health grant. Nice. Then I think I will hand over to Julia.
Good evening, everyone. And first and foremost, I'd like to say that I'm super happy to be here with you today. I would like to thank WordChild for giving us a chance to implement ReachNow in Ukraine. We have just started this process yet. I believe what we have already done has made some difference for Ukrainian children. But before I move on to ReachNow particularly, I'd like to give you a little bit of context of who we are and what we do in Ukraine. So on the first slide, you have seen our mission that no child in Ukraine should be left alone with the experience of war, and this is what we are working towards. So at the moment, we have 130 professionals in the field, which means that we have psychologists, local administrative staff there, and these people are working on 13 established locations. So we have locations both in the western and eastern parts of Ukraine, as well as one location in the south and one location in the north. And we are really expecting to grow even more next year. But for now, we can say that we have a pretty solid coverage of the regions who are either affected by the war itself or the regions that are hosting a lot of IDPs. Our back office in Kyiv hosts approximately 80 professionals. Even though I'm formally considered to be a part of the Kyiv office, I'm based in Kharkiv, so I can see the implementation of what we do right in the place where war was the most brutal. Over the course of our work, meaning starting in 2019, we have helped 64,000 children in various ways. Our fund is a primary role that we have figured for us in Ukraine. We are providing MHPSS services to children and their caregivers because we believe that such a holistic approach to the family as a whole will be able to provide child with an appropriate environment to grow in. At the same time, however, we are also providing individual humanitarian support, meaning if we have a child who is unable to study because they don't have a laptop for online studies, we do our best to create those opportunities for child development. In addition, we do a lot of advocacy, both internally and externally in Ukraine and abroad. We have a book called War by the Voices of Children, where you can see the quotes from Ukrainian children of what they see during this war and what they experience with this war. And this book has traveled around 15 countries at the moment and is a really nice instrument for our colleagues in Europe to understand how it looks like for children in Ukraine right now. Apart from that, we have a movie, A House Made of Splinters, which was nominated for Oscars this year. And we also use it as an advocacy tool to fundraise, to do what we do in Ukraine, to help children to cope with the experience of war. And can we go to the next slide, please? So how ReachNow was implemented by Voices of Children. I would like to thank War Child for sharing this tool with us, and we do really believe that this is an amazing opportunity for us to detect children earlier than they come to us with more severe cases and instances. And at the beginning, we only had 6 MHPSS professionals trained at Voices of Children. Later, we were able to scale it up. At the moment, we have 20 professionals that are aware of the ReachNow tool and its implementation. So basically, the 6 professionals after the TOT held another TOT at their locations in the field. And right now, we have started implementation directly with our end users. You have already seen a similar slide on Anna's presentation, where this is basically an implementation path. And Voices of Children has a great chance to create a whole ecosystem of providing MHPSS services to children, since we are the providers of this MHPSS help. We have identified school teachers as our end users, since they do qualify for both criteria that Anna has mentioned. They are in regular contact with kids, and they also are pretty much trusted by the parents. At the same time, however, we had 2 additional criteria that we as Voices of Children believe in. First, we already have pre-established contact with teachers because we are working with Ukraine-based methodologies and help teachers to prevent professional burnout. And second of all, right now during the war, teachers, have even more workload and more responsibility, because they are also responsible for the safety of children. And school became a place where children can socialize, being limited in socializing activities outside of school. So that's why we have selected school teachers, and we have conducted ReachNow trainings for them. Basically, as you can see, school teachers are the ones who are proactively detecting children who are in need of MHPSS support, and they encourage help seeking, referring children to Voices of Children Foundation. Here at Voices of Children, our professionals are conducting needs assessment and are also providing care. We did not have instances of further referral at the moment. However, we do understand that if there are some extremely severe cases or maybe cases of child abuse, those will need to be referred further on. However, for the mild cases, we are able to cope with them with our internal resources. And I believe this is what creates a pretty nice loop where we have the services available to people, which means that we are able to proactively detect those children. At the same time, the context of war brings in a little bit of outside challenges to implementation of ReachNow, because we need to understand that some children are not going to school offline whatsoever. Some teachers are hesitant to go to a training because it might be dangerous, and that's the example of Kharkiv, because currently we're planning to hold a ReachNow training, and the local administration told us that the only way we can do this is holding this somewhere in a shelter or at the metro station, and that's the option we're sticking with. So implementing ReachNow in the war context or in a conflict context, from the feedback that I'm getting from our psychologist is that you have to be aware of the challenges the people who will be your end users are dealing with, because they're always under stress, just as any other human being. They might be stressing about their relatives somewhere else. Maybe a member of their family is at the front line or went missing. So this is something that we're also taking into account and providing teachers with tools to prevent professional burnout, because without that, ReachNow is kind of like an additional workload for some. So that's why you have to stay aware of those limitations and provide with some maybe extra tools, not just to proactively detect a child, but to cope with stress for the teacher or any childcare professional that is your end user. Overall, from the feedback that we have already gotten from our end users, from teachers, this tool is super helpful, because before that, they did have an idea that some of the children might need MHPSS support. However, at the same time, they did not have something to refer to, and did the referrals mostly intuitively. They had no idea of how to talk to parents, how to be ethical in this situation. So with the provision of ReachNow tool to them, they feel more confident in detecting those children and in talking to parents about the concern that they are having. Apart from that, having our contacts and being able to refer to Voices of Children, teachers are also sure that the child will be able to receive this care free of charge, and this care is accessible, affordable, and is really high quality. So this is how we're implementing ReachNow, and we can go to the next slide here. That would basically be it from my side. Here you can see our contacts in case you have any questions, comments, concerns, or would like to have some kind of partnership with us or exchange your experience. We will be more than glad to do so. So feel free to contact us, and thank you so much for your attention.
Wonderful. Thank you so much, Yulia. That was very interesting. And yeah, I just wanted to know that you were saying how important it is also to support the end users themselves. And that's why really the ReachNow fits as a tool within, an ongoing programmatic approach. So making sure that your programming is holistic and socio-ecological and multi-leveled, and targeting, not only the children, but also the people around the children who are supporting them. So yeah, that really resonates with us as well. As well as that, you mentioned, how the end users that you're working with already had some intuitive skills in being able to identify children who might be suffering or who might be having difficulties, which is actually the case across contexts that we work in, that people who work with children really do notice this and observe these signs of distress in children naturally and in their relationships. And really, as you said, the value of the ReachNow tool is giving them a delegated role in this detection and making it clear for them who is that first point of referral, and giving them the confidence to approach families with advice and be able to do that kind of ethical kind of help-seeking encouragement, ensuring that that information is confidential, and we really see it gives them the confidence to create those linkages. So thank you very much for sharing. And it's really a great example of a best practice implementation. Then we will move into the Q&A part of this webinar. Would be very curious to hear your questions. So I'm just going to give everybody a couple of moments to write your questions in the chat. Mirta and I and Julia will be taking a look, and feel free to address your questions to any of us.
I think I'll pop in here really quick because there was a question in the chat, not in the Q&A, in regards to whether you could share our chatbot with people, with refugees from Ukraine abroad. Sure, you can, and please do. You can share this because Voices of Children, apart from providing MHPSS support at our locations, does have an online support line where a child or their parents can have up to 10 individual counseling sessions. So please feel free to contact us, and we will be really great to provide support to those who are abroad as well.
Questions.
Great. Then I don't see any other questions in the chat at this moment. We'll maybe come back if there are more questions that are added. And I would like to hand over to my colleague Pamela, who will describe our community of practice. And I see a hand raised, but I don't believe that participants can unmute. So maybe if you have a question, could you put it in the chat? And then we'll come back to you after we give over to Pamela. Go ahead, Pamela.
All right, and thank you, Anna, and hello, everyone. I'm really excited to extend a warm invitation for everyone to join our community of practice. Could you please move to the next slide? Yes, perfect. To join our community of practice, which is developing in the framework of the WellU project. So this is a peer-to-peer platform which is crafted to knowledge exchange, collective problem solving, and building meaningful connections in the field of child protection. So our community practice, it thrives on a champion-driven structure. So we provide both formal and informal guidance, and we join hands with practitioners, policy influencers, and decision makings from across Europe to support migrants and refugees, particularly those affected by the Ukrainian conflict. So this is our excellent opportunity to delve deeper into the discussion on this webinar from ReachNow. So if you have any further questions on this tool and the other tools that are being used and developed during the WellU project, so we invite you to go to this to our community of practice. Then can we go please to the next slide? So there are 4 easy steps to join our community of practice. I will quickly put the link on the chat. So you go to the website, and then you will have to create an account. you click on the section Make Connections Forums. You go directly into WellU methodology forums. It's divided into the 4 MHPSS methodologies used in the WellU project. And then if you have particular questions for each of them, you are able to connect, and we'll make sure to answer. And hopefully this will foster a deeper discussion on methodologies. Yes. And can we go to the next slide, please? And yes, by joining our community of practice, you not only contribute to a collective effort in child protection, but you will also be part of a network that is passionate about making a positive impact. So I really look forward to connect, collaborate, and make a difference together. Thank you. That's it.
Thanks, Pamela. And yeah, hope to see you all on the community of practice. We have a few more minutes for Q&A, but I think I would quite like to share that the ReachNow tool is available to other organizations. If you're interested in exploring contextualizing or implementing the tool, please do get in contact with Mirta and I. It's already available in 13 languages. And the contextualization period usually takes around 3 months for the initial contextualization, and then quite a bit longer to validate the tool and make all of the adjustments so that it's fully finalized. But it would be, yeah, very interesting to see how to explore those type of partnerships. So please do reach out if you see a need that the ReachNow tool could fulfill. Then, if not, I will end this webinar. We're very nicely on time. And don't forget also that we have an exit poll, which we would be very grateful if you could fill in. Thank you. It's on the screen now. And I'd also like to say a really big thank you to Child Hub and our colleagues in TDH Hungary, especially Marta and Heidi, who have really supported with setting up this webinar. Yes, we're really grateful for your support. Great. Thanks, everybody.
Thank you.
And there will be more webinars in this series coming out from WellU, focusing on MHPSS best practices and some challenges also in being able to implement evidence-based methodologies and methodologies specifically targeting lay people within a European context. Wonderful. Thanks, everybody. See you. Bye-bye.
Bye.